Hello, I'm Sissel Urk-Olsen I'm a clinical dietitian from Norway. My research is focused on refeeding syndrome in older malnourished patients, and I am now currently also working with hip fracture care. I also represent nutrition in FFN Norway, and I am active in several European networks with focusing on advancing the dietitian's role and improve nutrition in Europe. So what can be done to improve the number of people who receive Simple 6 action? Changes can target increasing the capability of health workers, patients, and carers through better knowledge, skills, and understanding. It is also important to create opportunities to make the right thing to do easier to do. Finally, it's important to consider improvements that motivate people to do the right thing. Over the next few slides, we will share lots of different ideas of improvements. Some of these ideas might be very useful in your setting, others might not be relevant, and that's okay. You might already be doing some of these things, and we know for sure that people around the world are doing many other great things that aren't listed here. These are just examples to help individuals and teams start thinking. Please don't try to do everything at once. Instead, we suggest choosing one idea to test at a time. Try it out with your local team and patients. If it helps improving things, great. Keep doing it. If it doesn't work, make change or try something different. This approach is supposed to be a model for improvement and the can be. If you want to know more about these, links are available in reference of this unit. So what can specifically help improve awareness of malnutrition or nutrition risk? To help staff understand and talk about nutrition risk, we can improve their knowledge, skills, and understanding. This is called building capability. Consider adding nutrition training to staff onboarding and ongoing education. Nurses and others should be supported to screen, assess, and diagnose malnutrition. If staff understand why early awareness is important, they are more likely to act. So it is really important to increase staff understanding of the benefits of early awareness of nutrition risk or malnutrition. We can also give staff easy tools to remember what to do, like posters or quick slides. Lastly, real-life stories or case example can help staff learn how to improve nutrition risk awareness in their daily work. We should also do things to improve the knowledge and understanding of patients and carers. Show them how to connect nutrition screening or assessment results with what matters most to the patient, like their personal goals and treatment choices. Support staff to talk about malnutrition in a kind and respectful way. Use simple, person-centered language and speak with patients and carers. We can also give staff easy tools to remember what to do, like posters or quick guides. Encourage patients and carers to ask about nutrition. They have the right to know if they are at risk or are already living with malnutrition. To improve patient awareness of malnutrition or nutrition risk, we need to create opportunities. In every practice on the ward or other clinical settings, there are lots of opportunities to improve awareness of malnutrition or nutrition risk status. Start by ensuring that all hip fractures patients are considered at risk of malnutrition until they have been assessed. For other patients, use a validated screening tool. What this exact tool is will depend on your setting. This can help to identify nutrition risk early and consistently. Patients identified as at risk or malnourished should be offered verbal and written information. Exactly how nutrition risk or a diagnosis of malnutrition is communicated will depend on the patient. No matter what, exact words are used, check the understanding of the patient or the care where appropriate. Encourage them to ask questions and discuss their concerns. Also make sure any written information resources are adapted to your local setting. It can be really helpful to work with patients and carers when doing this. Use visual cues such as color trays or other discrete indicators can be useful. These can prompt staff to respond and keep nutrition risk visible. But they usually work well when other improvements are also provided, like staff and patient education and changes to workflows. Include nutrition risk as a routine part of bedside handover or ward rounds. This helps ensure all team members are aware and can act appropriately. Also invite family members or carers in conversation. They can help explain information and support patients to take nutrition risk seriously. We can make it easier to take the right action by changing policies and systems. When the system supports good care, people are more likely to do it. Review and improve your policies, procedures, and care pathways. Make sure they include steps to help staff notice and respond to malnutrition or nutrition risk. Technology can also support this process. Use computer alerts and prompts to remind staff to check for nutrition risk. These tools can support proper screening and assessment of all patients. Make sure all health workers can easily see if a patient is at nutrition risk. This information should be clear and easy to find in medical records and other electronic systems. Apply these same systems to remind staff to give information to patients and care. Add a flag if this step is missed so the team can follow up. One of the strongest ways of increasing and maintaining awareness of malnutrition or nutrition risk is to motivate people to care and to take action. Start by setting clear goals for nutrition risk awareness, track progress, and report results back to teams. Encourage senior clinicians to talk about nutrition risk during ward rounds. This helps show that it is part of everyday care. Add patient awareness measure into routine workflows. This makes it easier to monitor change over time. Provide feedback using simple visual dashboards or posters. Teams are more engaged when they can see their progress. Celebrate teams that show improvements or maintain high awareness rates. Positive recognition is a powerful motivator. You might also want to use patient stories shared in posters or team meetings to remind staff why improved awareness of nutrition risk and malnutrition leads to better nutrition and better outcomes. Outside of your ward or team setting, there are other ways to motivate people to care and take action. Ask respected opinion leaders or even celebrities to explain why awareness of nutrition risk is important. When messages come from trusted voices, they are more likely to be heard. Celebrate teams that show improvements or maintain high awareness rates. Positive recognition is a powerful motivator. Consider creating friendly competition between wards or hospitals. This can build energy and focus around the issue. Finally, consider connecting nutrition risk awareness with patient safety or hospital goals. This shows that it is not an extra task, but a part of the care. So who can improve awareness of malnutrition and nutrition risk? Nurses can explain nutrition screening results, hand out written information, and remind patients why they need to eat and drink. Malnutrition is one of the strongest predictors of poor outcome after hip fracture surgery. This is why it's important for doctors to routinely explain the result of nutrition screening and assessment. They can support patients by clearly discussing what malnutrition means and the treatment options available to support the recovery. Doctors are often best placed to include malnutrition diagnosis and treatment plans in discharge documents. Allied health professionals such as dietitians, physiotherapists, occupational therapists, and speech pathologists can help identify if a patient may be at risk of or is already malnourished. Where they can really stand out is to make sure patients are aware of their diagnosis and link nutrition treatment to patient-centered goals. They can also raise concern if a patient appears to low risk but is not eating well, or if poor access to nutrition might affect rehabilitation or recovery. Healthcare assistant can help by noticing if someone is not eating, asking if they understand why they need supplements, or reporting changes. With training, assistant providing basic information about nutrition risk status and treatment option is now considered within scope of assistant practice. In many settings, student trainees and volunteers can often take time to talk with patients. Again, with suitable training, in some settings they can check to see if patients are aware that they are at risk of malnutrition or are already malnourished. And importantly, everyone can work together to make sure that system protocols and policies also support awareness, so it becomes part of the routine care, not just individual effort. Together, all of these actions can help patients understand their nutrition risk and give them the best chance to recover. If not, it's not just the clinicians team. Many other people can help improve awareness of malnutrition or nutrition risk. On the system and support side, clerks and admin staff can help make sure nutrition forms are completed and shared. Food service staff can speak up when they notice someone is not eating or being fasted again. IT and EMR teams can build prompts, alerts, and tracking tools into the hospital system and improve the visibility of nutrition risk or malnutrition to all members of the team. This is really important to help all team members contribute to better nutrition and better outcomes. Hospital executives can prioritize nutrition policy and planning. Educators can include nutrition risk awareness in staff training and onboarding. Safety and quality teams can include nutrition in audits and improvement goals. And funders can support better system staffing and innovation. On the advocacy and influence side, patients and carers can ask questions and help others understand why nutrition matters. Advocacy groups can raise awareness in the community and push for better standards. Professional organizations can support guidelines and continue education. Researchers help build the evidence we use in practice and policy. And importantly, when all these people work together, we can make sure our system, protocols, and policy actually support nutrition risk awareness, not just rely on individuals to remember. So who can help improve awareness of malnutrition and nutrition risk? Nurses can explain nutrition screening results, hand out written information, and remind patients why they need to eat and drink. Malnutrition is one of the strongest predictors of poor outcome after hip fracture surgery. This is why it's important for doctors to routinely explain the result of nutrition screening and assessment. They can also support patients by clearly discussing what malnutrition means and treatment options available to support recovery. Doctors are often best placed to include malnutrition diagnosis and treatment plans in discharge documents. Allied health professionals such as dietitians, physiotherapists, and occupational therapists and speech pathologists can help identify if patient may be at risk of or is already malnourished. Where they can really stand out is to make sure patients are aware of the diagnosis and link nutrition treatment to patient-centered goals. They can also raise concern if a patient appears to low risk but is not eating well, or if poor access to nutrition might affect rehabilitation or recovery. Healthcare assistant can help by noticing if someone is not eating, asking if they understand why they need supplements, or reporting changes. With training, assistant providing basic information about nutrition risk status and treatment option is now considered within scope of assistant practice. In many settings, students, trainees, and volunteers can often take time to talk with patients. Again, with suitable training, in some settings, they can also check to see if patients are aware that they are at risk of malnutrition or are already malnourished. And importantly, everyone can work together to make sure that system, protocols, and policies also support this awareness. So it becomes part of routine care, not just individual effort. Together of all these actions help patients understand their nutrition risk and give them the best chance to recover. It is not just a clinical team. Many other people can help improve awareness of malnutrition or nutrition risk. On the system and support side, clerks and admin staff can help make sure nutrition forms are completed and shared. Food service staff can speak up when they notice someone is not eating or being fasted again. IT and EMR teams can build prompts, alerts, and tracking tools into hospital system and improve the visibility of nutrition risk or malnutrition to all members of the team. This is really important to help all team members contribute to better nutrition and better outcomes. Hospital executives can prioritize nutrition in policies and planning. Educators can include nutrition risk awareness in staff training and onboarding. Safety and quality teams can include nutrition in audits and improvement goals. Funders can support better system, staffing, and innovation. On the advocacy and influence side, patients and carers can question and help others understand why nutrition matters. Advocacy groups can raise awareness of the community and push for better standards. Professional organizations can support guidelines and continuing education. Researchers help build the evidence we use in practice and policy. And importantly, when all these people work together, we can make sure our system, protocols, and policies actually support nutrition risk awareness, not just rely on individuals and individuals to remember. There are many points in a patient's journey when we can improve how we identify and improve awareness of malnutrition or nutrition risk. The most obvious one is at point of identification of a hip fracture or as positive risk screen or assessment. Wherever that happens, people screening should be trained and empowered to provide results of the screen or assessment and not just make a referral to someone else. Patients can also get frustrated when they are asked lots of questions but do not get any answers. Identification those with or at risk of malnutrition should happen early. For example, during the surgical booking or preoperative planning for elective patients. Otherwise, in the emergency department triage or when patients are first admitted. Daily care routines offer important chances too. Bedside handovers or multidisciplinary rounds are good times to check awareness of nutrition risk and make sure it's addressed, because often people don't remember everything they are told in hospitals, so it's really important to keep checking and reminding. We can also strengthen nutrition care during patient education and discharge planning. Staff orientation and training are also key times to set expectation and build capability. Nutrition risk can also change, so we should reassess for malnutrition when we see a drop in patients' intake status, or if there's a change in their clinical condition, or if they have been fasted for a long time or a number of times. If there has been change, make sure the patient or carer is aware of this. And finally, transition of care such as ward transfer or discharge are really important moments. We must make sure nutrition information to support awareness of malnutrition is handed over clearly to ongoing care providers. This can help them keep the conversation going. There are many areas across the hospital where we can build better systems to support nutrition care. One important place is the electronic medical record. EMR alerts and prompts can help staff remember to assess and follow up on nutrition risk. They can also be really helpful to improve visibility of nutrition risk, for example, by automatically populating daily notes and discharge summaries. Discrete visual reminders at the bedside or in the patient's room can also support awareness and action. These might include signs, stickers, or tray identifiers. These can be really helpful to assist staff on ward rounds, during therapy session, or at meal times to encourage conversation about nutrition risk awareness and treatment options. Food service system are another important area. Changes here can make sure patients get the right food and support at the right time. Ward level safety briefings and daily huddles offer practical time to check on nutrition needs alongside other safety issues. Orientation and training programs for staff are also key. These are good opportunities to build capability and set clear expectation about nutrition care. At a higher level, quality dashboards, executive reports, and clinical registers can track progress and keep nutrition on the agenda. Policies, procedures, and governance reviews are also important levers. These shape how care is delivered across the system. And finally, shared care platforms that link hospital with primary care can help continue nutrition care after discharge. This is especially important for follow-up and continuity. Small and larger changes in the right places will make nutrition risk awareness a normal and expected part of care. These changes don't need to be complicated. Make them simpler for better nutrition and better outcome. We invite you to watch this short 3-minute animation. It shows the difference simpler improvements can make. His journey shows how early nutrition care can really help. Even if you've seen this video in another unit, it's worth watching again here. It might be helpful to look up for the things you have learned in this unit. After you have watched the video, we will then invite you to take some time to reflect on what you might be able to improve in your setting. It's time to reflect again. What are 2 or 3 realistic changes you think could improve awareness of malnutrition or nutrition risk in your setting? These could be changes that influence capability, opportunity, or motivation. Also think about who could be involved and when and where the changes could happen and why the change is important. Just put in a few of your thoughts. This is not assessed, it's just to get you thinking.